Hi everyone, welcome back. So today I am going to be doing a post about the deltoid muscle, which is this main muscle on the tip of the shoulder here. And I'm going to be talking about injury to this muscle, which is mainly tends to be sort of your usual muscle strain, how you can treat it, who's at risk of it, and all the usual information that I provide on these type of posts. So the deltoid muscle, as we said, it's that main sort of bulk of muscle on the tip of the shoulder there, and it's actually got three heads. So it's got the anterior, which runs down the front here. Then you've got the medial head, which is that main bulk. And then you've also got the posterior head, which comes down the back here. So between the three heads of the deltoid muscle, really sort of the shoulder joint is surrounded. It's a large muscle, and it extends from the collarbone here, right the way to the outer arm. So it really does sort of encompass a fair area. And its main function, it's used certainly to stabilise the shoulder joint, but also in terms of movement, it's used to obviously lift the arm up out to the side, and also lifting the arms out in front. You're going to use that muscle there. So in terms of injury to this muscle, who is going to be particularly at risk of getting injured here? So it's more common in athletes who obviously are going to have overuse of that shoulder joint. So anyone like weightlifters, baseball where you've got the overarm throwing, even swimming and even skiing, where there's sort of overextension of that deltoid muscle, anywhere where there's the potential for that, you're going to be more prone to injury. Obviously with bodybuilders, if they're sort of particularly focusing on on this area, it can cause overuse, and that's why as sports therapists, we would usually recommend people going into the gym to have a slightly more varied workout program, so that you're not just focusing a whole workout on one specific area. You want to be working a few different areas. Also, if you have had a fall or a sudden injury that maybe dislocates the shoulder, again, that can damage that deltoid muscle that surrounds that joint. Obviously, we talked a bit about overuse there in terms of sort of athletes, but also in terms of occupational overuse. So if you have a job where, again, you're required to have, repeated sort of overhead movements. So this could be something like a mechanic, obviously, who's sort of laying down and sort of reaching up under the car. And also construction workers, obviously carrying things up on their shoulders. Again, there's going to be a lot more stress on that shoulder joint. So main causes of any type of injury or strain to the deltoid muscle, will certainly obviously be caused by overuse, as we've said, and those repetitive movements. But another cause is where there is forced eccentric contraction of the shoulder muscle. So that means where the sort of belly of the muscle lengthens while contracting. So maybe an example of this would be negative weightlifting reps. This could be, a common issue. Okay, other causes. If you have some sort of direct traumatic blow to the shoulder, so we could we sort of mentioned about dislocation there, but also maybe if you've been in a car accident or even in contact sports such as rugby, if you've got a head-on collision, potentially that could also cause some damage. Also axillary nerve issues. Now, the axillary nerves stimulate the deltoid muscle when using the shoulder and the arm. So damage to these nerves will also affect muscle function, possibly, where you'll experience numbness, weakness all across that outer shoulder there. And also trigger points. Is the other thing which may potentially cause referred pain. That it could potentially seem like the issue is in the deltoid, but it could actually be referred pain from a trigger point elsewhere on the body. So in terms of when we get these muscle strains in the deltoid, as if you've watched any of my other videos that focus on particular muscles and muscle strains, you'll know that there are 3 grades of muscle strain. There's grade 1, grade 2 and grade 3, and it's no different with the deltoid muscle. So a grade 1 muscle strain is really a mild strain. It's a minor tear of the muscle, just involving maybe 10% of the muscle fibres. It will cause mild pain in the shoulders, but you generally, be able to carry on using the shoulder for activities without too much difficulty. If you do get any swelling, it really will be, minimal swelling. You may get increased pain when, weight bearing. So sort of if you were sort of doing weightlifting down the gym, then yes, you may get increased pain. But generally, the shoulder and even into the outer arm will feel a bit achy, a bit tight, maybe for sort of 2 to 5 days after the injury. And recovery from this is really quite quick, usually within 7 to 10 days. Now, if you have a grade 2 injury, that's a little bit more serious. This is actually a partial tear of the muscle. So it's going to affect over 50% of the muscle fibres. And it usually results from some sort of major injury. So we'd be looking at things like, a traumatic blow or, where there's been a dislocation or, something like that. There is likely to be a partial rupture of the muscle. And consequently, you're going to experience sharp shoulder pain, increased pain also if you press the fingers into the deltoid muscle. And consequently, you're going to also have reduced range of motion, and you're going to have difficulty in, carrying on with your usual activities. There's also likely to be mild to moderate inflammation and swelling, which is going to obviously cause weakness and difficulty in lifting the arm to the front, to the side, or even to the back. So, even sort of carrying just a small weight, is probably going to be quite painful. You're certainly going to struggle to do anything like push-ups, and you're going to be feeling quite achy and tight for at least a week after injury, and looking at a recovery time of probably about 4 to 6 weeks. So, there's quite a sort of step up from the grade 1 strain. Now, the most serious muscle strain is grade 3. Now, grade 3 is actually a complete rupture, or sort of over 90% of the muscle fibres. And you're going to know it when you've done this, because you will have immediate and very severe pain, considerable bruising and swelling, and you're basically going to be unable to move the arm, not able to use the shoulder for any activity. You know, it's going to be aching and tight for around a month, potentially just over a month. Even just a slight flex of that muscle, you're probably going to see quite a bulge in the muscle, and any contraction, again, you know, it's going to be really quite painful. Recovery for this, you know, is probably going to be about 3 to 4 months, so it's quite extensive, and you're going to be prone certainly to muscle spasms. And also the difference with a grade 3 is that at the time of injury, you may well sort of feel or even hear a kind of a popping sensation or a snapping kind of sensation at the time of injury, almost like when you know, when you sort of rupture a ligament. So yeah, you know when you've had a grade 3. And in fact, I recently saw a sports massage client who he sort of said to me, oh, you know, I've had this lump on my arm, you know, for many years now. He said, I still don't know what it is. He said, you know, the doctor said it might be some kind of cyst, but, you know, he wasn't sure. And actually, when we talked, and he said that he'd had a bit of an injury to his shoulder, and when I sort of felt around it, what he'd actually done was completely rupture, you know, one of the heads of the deltoid muscle, and it had, in fact, as many muscles do when they're completely ruptured, bunched up, and that's what the bulge was. So, okay, so in terms of treatment of these deltoid strains, if you have a mild grade 1 strain, it actually doesn't really require that much in the way of treatment. You know, just rest, ice packs to take down any inflammation, but there's unlikely to be that much inflammation with a grade 1 strain. You know, you can sort of use compression just to sort of assist with the circulation, and elevation, just keeping, you know, your arm propped up. Obviously, if it is painful, you can use anti-inflammatories, but it really shouldn't require any more than that. Obviously, now if you go into a grade 2 strain, you're starting to look at probably needing some physical therapy to reduce pain, increase motion, increase muscle strength. So maybe going for a massage, although you would have to wait until the inflammation has subsided and the pain is at a level that is manageable. You initially could use ice packs, again, to take down the inflammation, and some people like to alternate that with heat packs. So the ice reduces the inflammation, and then the heat pack just helps the muscle relax. Usually sort of 1 to 5 days after injury, you know, you'd look at introducing heat packs. You can also, once the inflammation and pain have subsided, start introducing gentle stretching. And I will be showing you at the end of this video some exercises that you can do. Due to the difficulty in resting the arm and shoulder, just because of the nature of where it is and how you use it, healing can take quite a long time. And so therefore the risk of re-injury is quite high, but often this is also due to people just basically returning to sport too early, which obviously, they're then risking damaging the muscle more permanently. Now, the aim of treatment obviously is to prevent further damage, but also to keep the formation of scar tissue to a minimum, and also prevent muscle atrophy, because obviously when you're not using a muscle, it will start to weaken, and the tissue can eventually die off. So so by sort of restoring strength and function, you're also sort of helping to to prevent muscle atrophy. In terms of recovery, now returning to sport, we touched on it just a minute ago when I said, if you return to sport too early, you are really putting yourself at high risk of re-injury, and that re-injury could be a lot more serious and risk permanent damage. So you really need to be sensible about, returning to sport. It can really, again, depending on the grade of strain, it will take anything from, a few days to a few months. And if you are someone who is in competitive sports, then certainly you have to regain full strength and full range of motion, be completely pain-free, and have completed sport-specific exercises before returning back to your training. Now, I'm going to talk a little bit, I'm going to sort of put forward a few shoulder exercises that you can use to basically strengthen around that deltoid muscle. There's also, if you go onto my Facebook page, there's also, if it's sort of an occupational thing, reason why, with overuse in your job, if that's the reason why you've strained the deltoid. There's also a video on my Facebook page, and I believe I've also, I'm not sure if it's on here on YouTube yet, but it's basically 10 shoulder stretches that it was intended for people working at a desk, but you can do, just one or two in your break from work. And it works all the muscles all the way around the shoulders. So exercises. Now again, I'm just going to stress you should only be doing these exercises once the pain and inflammation have subsided. So the first one is this one actually works on the posterior head of the deltoid, going round into the back of the shoulder, and you literally just pull your arm across your chest and hold for 10 to 30 seconds, feeling a stretch along the back here of the shoulder. The next one you can do, which will work around this anterior head at the front, you can do it either sitting or standing, and you just clasp your hands behind your back and stretch the arms out behind you, and you want to hold that for 10 to 30 seconds. Now, it may be that when you first start this, particularly if you're doing it sort of having had a higher grade strain, you may have to keep the arms really quite low to start with, but you can just gradually progress by sort of lifting the arms further up at the back. Now you can also do isometric resistance exercises. So for example, like pressing your hands into a wall, so that the wall offers some resistance, but it's not sort of high impact. They're sort of good ones to start with. But then once you've done these ones that I've shown you, you can then progress on to the following exercises, initially with a low weight dumbbell, or using resistance bands. And basically the idea is that you're going to be improving your flexibility and strength. These exercises can also be used to generally strengthen the deltoid muscle in order to prevent any injury in the future. Okay, so the first one is an external shoulder rotation. So you can lay on your side with the affected arm on the top, and you're going to hold a light dumbbell, literally like, even a bag of sugar would work. Hold the dumbbell with the elbow against the hip and the forearm held across the stomach. And then you're going to literally hinge at the elbow, and you're going to lift the dumbbell upwards in an arc by rotating the shoulder and lifting the forearm off the stomach. And then you're going to slowly bring the dumbbell back down to the ground and repeat. And then we have our internal shoulder rotation. So this kind of works the opposite way to the last one I showed you. This works the anterior deltoid, which is the head at the front of the shoulder. So again, you're going to lay on your side with the affected arm nearest the floor. Again, top of the arm close to the body, and elbow bent at 90 degrees. And the dumbbell will start out on the floor. Then you're going to lift, just as you did with the external rotation, lift the dumbbell up, hinging at the elbow, lift it up in an arc to bring the dumbbell in towards the body. So you're going to be rotating the shoulder joint inwards and lifting that dumbbell until the forearm touches the body there. And then you're going to slowly lower it back down to the floor. Now the next one are these lateral raises. Now again, when you start these, you want to start with a light weight, okay, and progress slowly. So you're going to stand while holding the dumbbells in front of the legs with both palms facing each other. Then you're going to raise the dumbbells to the side until the hands are at shoulder level with palms facing down. And then you're going to return to the start position, slowly lowering them back down, and repeat. And this will work that medial head, that main bulk of the deltoid in particular. Okay, and then the final one is a forward dumbbell raise. So with this one, again, using light dumbbells and progressing slowly if you increase the weight. So this one works around the anterior head of the deltoid at the front of the shoulder and the medial head, which is the main bulk of the deltoid muscle. With your arms down by the front of your thigh, palms facing towards the body. And then you're going to slowly raise one arm up to shoulder height, out in front, and then slowly lower back down. And then you're going to repeat on the other side, and alternating each arm. Now, as I said, you do need to be cautious. Do not do these exercises until you're pain-free and the inflammation has subsided, and do progress slowly, starting out with a lightweight dumbbell. As I say, you can also use a resistance band if you prefer. So that's really it on deltoid strains. There are various other posts already up on my channel regarding shoulder injuries, so things like shoulder impingement, slap tears, shoulder dislocation. So do take a look at those as well. There's some more stretches on those posts for the shoulder in general. And so yeah, there'll be more posts coming out. So if you want to be notified of those, do subscribe to my channel. Feel free to comment down below, or if you have any sort of queries or questions, you can contact me through my Instagram or Facebook pages and I will come back to you. But for now, that's really all from me. So take care, and I will see you next time. Bye.